Hello, and thank you for inviting us to speak today at the Pathogen Surveillance in Agriculture, Food, and the Environment. And I'd like to talk about FDA on how it uses WGS. Plus, I'm going to talk about cost, benefits, and budget. Genomic epidemiology has been around for a long time. It starts with a signal, and genomics is only the most recent subclustering technology. Then there's the epidemiological component, and then investigation. You don't have to memorize all the different offices at the FDA, but I want to help explain how our office uses this. The genomics itself was developed by the research and development arm of the FDA. And once they have working applications for food safety, they pass these on to the regulatory arm, which is our ORA. And they're the inspectors that are going out, collecting samples, isolating the bacteria, and sequencing that data. And they sequence and upload to NCBI, and then it's another office that watches that signal. This is our analytics and outreach office, and they look at the data, they watch the data, and they try to see who does this cluster belong to. If it's a current outbreak, then this might suggest an emerging outbreak and contamination, and they want to send it to our outbreak response group, the core. But if it's an older isolate or a problem that is reoccurring, they want to send this and communicate to the Office of Compliance, who deals with whether and how a food producer is actually solving their contamination problem and getting it under control. So, and they may ask for additional inspection, which goes back to the ORA, or depending on what they find during the root cause of the outbreak, this may become policy. So these are other offices, or if it involves international firms, then that includes our Office of International Engagement. The inspectors would go back and look for pathogens, or we may have found the pathogen initially in a processing plant, but the inspectors are going to ask the question, where did the food from that plant come from? And it might trace all the way back to individual ingredients and farms. And the other, what we say, trace forward and trace backward, is where did that food go? And the goal is to find out where the contamination had occurred, the root cause, and all of the foods that received that contaminated product. And the goal is to remove the contamination from the food supply. And so this takes a lot of time because of a lot of this is written. And so another big part of FDA is to electronically capture the where food has been, to trace it back. Uh, so what we're most interested in is looking for a resident pathogen. These causes the most contamination and outbreak. And so a resident pathogen can either be in the field. This could be contaminated water or contaminated soil amendments. It may be the adjacency to animal production. And similarly, when these foods get harvested and go through food processing, some of those pathogens can actually take up residence within the processing facility. And the problem is when they become resident and are surviving, they're around longer and they're slowly oozing out into the food that's produced there. And then this is when we see a lot of food get contaminated and multiple people getting sick. And so our focus is to identify these root causes. Transient pathogens pass through, they may get a few people sick, but it's not the bigger problem. We've been collecting data now for a few years, and we've been accumulating more and more data. We put this at the NCBI to have a One Health perspective where isolates from animals, food, and the clinical and the environment are all together where they can be clustered. And it's our CDC collects most of the clinical isolates. The USDA FSIS collects most of the animal isolates or the meat isolates, and the FDA collects most of the food and environmental isolates. We currently have 31 labs across the U.S. Collecting in our domestic program, and we're producing roughly 8 or 9% of the data, but we have many additional collaborators around the world sequencing and uploading and sharing data at the NCBI pathogen detection. We also have international engagement. Mainly, we're collecting water samples in Latin America, but we're also doing work on shrimp aquaculture, as well as the APEC, is the Asia Pacific Economic Cooperation, which are 21 entities around the Pacific Rim, and they all have interest in genomics and are at various stages. And so this is another way to get more diversity and to understand the foodborne pathogens globally. Along with the genomic data, it's critical that all of this information, when you share it, that it's standardized. And so we use the FAIR principles. And the idea is that you collect the data once and store it in a way where anyone else, any stakeholder can use and reuse that data. And so we do this with all our protocols, sit in protocols.io. All of our bioinformatic uh, uh, pipelines sit at Galaxy Tracker, which is an instance of Galaxy, so it's in the cloud. And all of our genomic data and the metadata that describes those isolates are found at NCBI, which is part of the broader sharing globally. Specifically, what we found is that it's better to use standard metadata to describe the isolate. And so we've worked with collaborators to develop a One Health enteric package. And what this package does is it creates standard words and descriptions of multiple places where you would find foodborne pathogens. And so there's how you describe the animal, how you describe the where you took the sample in a man-built environment, the food production environment, as well as on the farm. And all of these are available on the web. These are integrated through NCBI and their biosample as well as FDA. In terms of data flow, the different laboratories and stakeholders upload their data to different places. All the FDA national laboratories upload both to PulseNet as well as to NCBI pathogen detection. And then those data go into the larger INSTC database, and that's where analyses are conducted, and so we can get automated reporting directly from any data uploaded and released into the public domain. Here's an example where I searched on the word tahini and filtered, and these are just a few of the clusters that came up at NCBI pathogen detection, but I want you to focus on the upper left side. And this is an interesting case, and we're seeing more like this, where a product from one country, this was tahini from Israel, were linked to illnesses in the United Kingdom, Canada, and the US. And what it shows is that many foods that are traded globally, if they become contaminated, then you see clinical cases showing up around the world. And it may be that one of these countries determines the root cause of the illness and the contaminated product first, just because of the specific details of their case and the outbreak investigation. And so by communicating with each other, we can help each other globally remove contaminated products from the food supply so that other people don't get sick. And so it's a global problem, and we need to work together and share our data. If we're sharing effectively, and limiting the number of people that are getting sick from contaminated product, then there's an economic value. And there have been several economic studies, impact studies, to show the value of WGS when you collect it and use it in a timely way. And so this paper, Outwelt, was published a few years ago. And essentially, it has 8 different laboratories. And so there are different sizes, there's different instrumentation used, there's different total number of isolates being sequenced. And so it's a comparison to say, did the genomics perform similarly across this space? And what I want to say is that on the far right are the biggest labs. These are big labs that are sequencing thousands of isolates. And then on the far right, the far left, are smaller labs. And if you look at this, is each laboratory calculated their overall per sample cost for whole genome sequencing, and they had broken it down into reagent cost and equipment costs and staff costs. And what you see is that genomics, and this is in pounds, is always a little more expensive on average. It's like a third more expensive than using traditional approaches, which typically are PFGE. So the additional costs are primarily due to the cost of the reagents, which are a little more expensive. But a number of the first kind of study is what's called a break-even study, and it's essentially weighing the cost of building a genomic laboratory versus the cost of lives saved. And so I want you to look at the far left column, and what you can see a kind of breakdown. And the first is the cost of the total cost of the sample versus what's currently being done. Okay, and then they do how many isolates, so you have a per sample cost. Then you can determine how many isolates you're planning to sequence, and then that can be multiplied. And so in this case, they calculate a cost, and then to compare, so that's the cost of the lab for a year's worth of sequencing at this facility. And then to balance the break-even cost, you do the cost per illness. These are all in pounds, and so it's 12 to 13,000 pound or euros. What you see is that if you can save 3 isolates out of a roughly 300, you would essentially break even. And so this is what they're saying. What you can calculate is, with a modest reduction in averted illness, you can recoup or break even the cost of building the laboratory. And what's interesting is, across all these different laboratories of different sizes and capacity, they're all about the same. So here we see that the average reduction in illness of 0.7% would break even the cost of building the lab to the cost of averted illness. And just to show you the Ford et al. On the bottom, the Australians did this calculation, and they are a little bit more. It's like 2%. So somewhere between 1 and 2% reduction in illness is essentially would break even, and any additional averted illness would be a bonus, a cost. So at FDA, we did a different kind of study. Essentially, this is a model of how much averted illness is going on with the adoption of genomics. And the blue bars represent a food safety system that's counting up the number of outbreaks, the number of clusters, which foods were associated with which outbreaks, and the root cause of outbreaks. And in the orange kind of rust on the far right, that's the rising number of isolates sequenced and uploaded into NCBI. And what they're looking for is a correlation in the idea that the more you sequence, the more clusters you should identify. And if you act on them, the more illnesses should be averted. That's the theory. The model actually tests that correlation to see what it is. I'm not going to go into the details of the model. Suffice it to say, there are calculations. This requires a PhD in economics to build and not really understand these models fully. And so, rather than going into this, what I'd like to say is if you're interested in this kind of model, you should have your PhD economist talk to our PhD economist. You see is that essentially, if you look just at the left-hand column of listeria, in the first year of production, we calculate we're averting about $7 million in averted human illness. And the second year, it's almost 50 million. And in the third year, it doubles again to 114 million in averted illness. And so what this shows is that we didn't get millions and millions of dollars to build our genomic network. And so we broke even, and the cost of averted illness fully recovered all of the cost in the first or second year of using this genomics for food safety. In the grand scheme, at the end, essentially by 2019, we'd averted over $500 million of averted illness. And if you look at the trajectory of those earlier numbers, I'm sure we're now well within $1 billion of averted illnesses annually. And by actually measuring the salmonella, we reduced the burden, the illness, by 2%, and 6% for E. coli, and 13% for listeria. And like I say, today, if we fully watched these numbers, we're probably closer to 20% reduction of listeriosis in the U.S. Essentially, using genomic data and acting on it is economically beneficial. Essentially, for every dollar invested, we're reducing illness by $10. And I just want to point out, we're not the only ones to see this. Price et al. Recently published a review of economic reviews of whole genome sequencing, and there are 12 different case studies. And literally, if you apply genomics for infectious disease control, it works, and it works in the food industry, it works in hospitals, it essentially works wherever you try to use it.